Welcome to Beyond Normal, brought to you by HealthSpan Chicago. My name is Dr. Tyler Saunders. I'm a board-certified internal medicine physician, founder of HealthSpan Chicago, a primary care practice in Chicago's North Shore built around a single idea that normal isn't the same as healthy, and you deserve better than a passing grade. This series exists because too many smart, health-conscious people are getting too little out of the system. We're here to change the conversation, to bring real questions about how we think about our health, help you understand the evidence, and give you the tools to drive your health the way you want. We believe in health-driven goals, your goals, not anyone else's goals. And joining me today for the series, to the inaugural first episode of the series, is one of my best friends, former college roommates. We used to run together in college. It's TJ Luby. He's not a clinician, but he's the exact person this podcast is for. Sharp, curious, not willing to accept what the system hands him. TJ, welcome.
Thanks, Tyler. It's awesome to be here.
All right, so we've got a lot in store today, a lot of different topics to talk about and a lot of different things to do, and so we're going to kind of dig in, but how you been feeling? Everything's been going well?
Yeah, first podcast recording, so I'm looking forward to that. Never been on one before, but yeah, feeling great. Summer months here, and so yeah, how about you? How's everybody at home?
We're doing good. We're doing good. I got shifted to outside because the baby's sleeping, but it's beautiful outside and can't be a better day to be outside. It's awesome. June in Chicago. Yeah, a lot of people will. When it's 90 degrees in the next couple of days, a lot of people are probably not going to agree with that, but it's all good. So yeah, things are going well. Practice is moving forward, and that's one of the things why we're here to talk about this. And so to give a little background for the audience and things, I was working for a larger health system for the past 8 years, primary care provider, board certified, and also certified in functional medicine as well, trying to integrate the world of the integrative functional medicine into what we call as, or I'm going to use the term as conventional medicine or more traditional medicine, and trying to kind of find my way towards providing the best possible health for people. And that's kind of what brings us here. So almost, I wouldn't say a tipping point, but I decided to make a change more in the idea of I want to think about the patients in a different way, and I want to think about how I provide care in a different way.
Yeah, and you had some trouble there, like just with not your practice and being a good doctor, but more so the institution, right? Like you would meet people and want to help them, but you felt a lot of pressure with how many patients you had to see in a day. Do you want to talk a little bit about that and what brought you to the career you're beginning now with your own practice?
Yeah, and I think there's a lot of one is better than the other, and I think there's a lot of people that push against
Yeah,
convention and don't want it at all, and right, and I always want to be very cautious of this, but at the same time, like the idea of what I wanted to create was a very cool and novel thing that I think pretty much everyone appreciates,
yeah,
regardless of where you're coming from. But being able to actually like lay it out in real practice is where I began to struggle, starting to see like, can I create this model using an insurance-based model to provide it to many people, although the expectation for primary care providers is to see 2,000 plus patients. And that's where you run into a little bit of an issue where I can't know you specifically and the best way to take care of you and
yeah,
190, 1,900 other people.
yeah. I'm glad too that you point out like conventional medicine has a ton of perks. So like one thing, like my dad actually just recently had a major health issue and he needed to be in urgent care and have conventional medicine. But then you look at someone like me, I'm, 37, think about it. And I'm trying to optimize my health. So when I'm getting close to my 60s and 70s, I'm not facing some of the same thing he is. And, I don't really need to go in and, have a bunch of medicines taken, but I do want to know what can I do today to help me be in a better position there. And I think that's where something like your practice is a lot of interest for someone where I'm at, where my dad, he really just needed to get back to baseline,
Right.
which baseline isn't really the most healthy thing. And maybe we should talk a little bit about that of just what is like the definition of healthy, because I have plenty of people that are told like, yeah, you're great, but then there's one thing that happens and all of a sudden you're really not great. And I think what I want to do is how can I make sure that I'm as far away from that not great line, and how can I be really, really strong and have a great rest of my life. Because tell you what, Tyler and I mentioned used to run together. We ran collegiate cross country and track, and I still try to run from time to time, but it's a lot harder now than when we were in our 20s. I'm trying to chase that, body and that's functional, and I want to be able to continue to do things the rest of my life. And so, I think it'd be good to kind of talk a little bit about what can we do to optimize, and really what should we view as healthy, because I don't know if we're there.
Yeah, and I think that there's a lot of, we're going to talk about this in a couple of times in a little bit. I don't want to jump into it too quickly, and understanding the concept of longevity, health span, health. What are these things? How are they defined? The reality of it is longevity is a very simple definition. How long do you live? Health is not. We don't really have a good definition across the board, and one person can disagree with another. A person who's 45 years old can walk into the doctor's office and get a clean bill of health, not at the doctor's fault, but they did all of the things they were taught to do, and then that person can suddenly pass away of a heart attack. And then the question becomes, was that person healthy to begin with? And you can argue that most people in the United States are not healthy, but at the same time, we have to figure out what that means. And I think a lot of times that's where the personalization comes into this, because I can tell you, like, in order to be healthy, well, let's think about this. When we were 21 years old, 20 years old, and we were running, all the miles we're running, like, were we healthy? We stand back and look at that now and say, no, actually we weren't, right? And you think about all of the things we could have done better to be able to answer for that, right? But understanding and having a framework of that and what that looks like, what does healthy really mean? One of the definitions people throw out there is the absence of disease. And I think that's a fair understanding. But once again, the diseases are things that we've kind of created, right? Is metabolic dysfunction a disease, right? So,
yeah, and maybe this is a good time to pause. Like, really, what your practice goal is to bring optimization, really, and personal relationship, right? Because just a lot of people aren't getting that. When you see your doctor, like you mentioned, I mean, it's not that doctors don't want to do a good job, but they're pretty overwhelmed. Is that really the case?
Well, if you think from my perspective and how I would define healthy, like I'm not intentionally skirting around it. I don't really know what it is, but the reality of it is it's a unique definition for that individual person, and healthy could be something that allows you to do what you need to do when you need to do it, something as simple as that. I just saw a patient recently, older than the age of 60, and one of her goals is she wants to be able to get up off the ground when playing with her grandchildren, right? And so, like, that might be her definition of healthy. What we're trying to do clinically in our practice is understand where the weaknesses are, right? Identify those for those individuals to be able to make sure they can continue to think about those things. And the reality is that in the standard insurance-based model, the average appointment's actually about 13 minutes for a primary care provider. And so thinking about, like, what goes into that, right? How much time can you spend on their sleep or their diet or their exercise? And the reality of it is you spend very little, if none, because it's very difficult to do that, especially if you already have pre-existing conditions. You're refilling medications. You're doing a very different role than trying to keep health there, as you're trying to prevent disease from progressing, right?
Yeah.
So.
And I think, I mean, there's a huge interest in this space, and of course that's why we're on a podcast today. But you hear, people are tuning in. They're looking for information. So, you hear on some podcasts, oh, you should really take fish oil, or magnesium is really important to have, or you should get your iron checked, or like grass fed is what you should eat versus this, and don't eat farmed fish, eat wild caught. And then you go to Whole Foods, or you see there's a huge interest and demand for organic. And I think that it's great, but how can we know what's actually needed for you? Because, like, you go to your doctor and you say, like, hey, am I healthy? So yeah, you're great. You say, well, I want to know my levels of whatever it is, and they run some labs and they give you a piece of paper. Kind of like, what do I do with this? And so, how is HealthSpan going to be fitting in where there is this want for information, people are tuning in, and you hear, like, you should be taking fish oil, you should have your omega-3s, you should do this, you should have a good diet, you should avoid gluten, maybe not, you should avoid gluten. It's like so much information, but where do they go with it? And also, hey, I don't want to pay $1 million for this, or some place that's just going to not give me feedback. And so I think that's really where your practice is going to be a good fit for people. Maybe we can talk more through like what that actually looks like for a patient.
Yeah. I think that, you're kind of hitting it on the head. The idea is that there's a lot of noise. How do you determine what the right thing is for you? And unfortunately, the majority of people, what happens is they see it, they get sold on it, whether it's good for them or not, they give it a try. And in a lot of instances, things are helpful. In a lot of instances, they're not, right?
Sure.
I've seen patients come to me with supplements, 10, 20, 30 plus supplements based on someone's recommendation. And that doesn't make them all entirely wrong. You can argue that 30 supplements is probably almost always the incorrect answer, but the reality of it is like, if you're thinking about how to approach something, I have this like really unsexy answer, is that have somebody that understands it help you navigate it, right? And so that's where the premise of the practice comes in. Our practice is a membership-based model, which essentially allows access to me, the clinician, for a lot of these questions, a lot of these understandings. And that's one of the reasons we wanted to start this type of podcast for my patients specifically, is to say, well, why is everyone talking about peptides and you're not? Why is everyone talking about this type of vitamin D versus that type of vitamin D versus magnesium? There's 14 different kinds of magnesium. And like, why should I be taking this one or that one? Should I be taking it at all? And like, these for me, in the context of your whole clinical scenario, I can give you a fairly good understanding of the risks and benefits of these things. Oftentimes the risks are cost, sometimes they're not. And so the personalization comes with that, right? And so I do believe that the personalization is the recipe for success, right? And that's how we think about going beyond what we call normal and getting to the point where we're, I'd hate to use the word optimal because I think it gets thrown around, but how do we feel the best for us at that very moment and think about increasing the odds of continuing to feel that well 20, 30 years down the line? And so that's what we're after with the practice. We're trying to find the biomarkers, the tests and things that are going to actually help move the needle. And I think there's a lot of fancy stuff out in the longevity world that are, claiming to be the next best biomarker, the next best thing. And I think that there's a lot of good stuff, but there's also a lot of stuff people are spending a lot of money on when, if you have the right team with you. And I'm not even necessarily saying that me as an individual physician is the right person for everybody, but at the same time, if you have the right group, the right team, we see this in healthcare over and over again. There's good examples in heart failure, actually. Heart failure clinics around the U.S. are collaborative clinics with multiple different people within them. And we find that the outcomes seeing this whole group is better than seeing one person. Like, who would have thought? Multiple different mindsets in. And right, so my perspective on this is that I am one piece of the puzzle. The patient is the biggest piece. And then we can start to build what team is necessary to kind of help them move forward. And for some people, it's just the clinician. For some people, it's a clinician, a nutritionist, and a trainer. For some people, it's just something different. But it all depends on what their healthy is, which is their personal defined goal.
Yeah, that's great. And I think you're really grabbing on something that we should focus in on, because it's important, is having the patient be the piece that's important to be focusing on, but having like a pilot as you as the primary care physician to actually look at what's most important to them. As we talk about this thing, sometimes it comes up in many walks of life, is stepping over dollar bills to pick up pennies. And I see this a lot with like, oh, I heard this person should do supplements and, I should take this. And, like maybe if you actually get some lab work done and then have someone like you take a look at it, they can see the most important things. And the most important thing for that person could be like exercise. Like, it's like, hey, like all this stuff is actually not that important. Like, I sure you could take some fish oil and that would be helpful. Sure you could do this, but it wouldn't be great walking, multiple days a week and maybe some resistance training. And like having that person that can like refocus you is just so important. I remember this time, and I know I sent you this is like 10 years ago, but I worked for a larger corporation and they did labs for everybody, free labs. And if you did it, like, because it was helpful for their insurance, they gave you like $100 gift card. So everybody does it. You get blood work done. It's great. And they gave it to me, and I I can't make heads or tails. I sent it to you, and you're like, yeah, it looks fine. There wasn't a lot in there though, like, and it's just like
Right.
metabolically healthy, 30-year-old male.
Right.
But I think what you're going to be working on is like, hey, I want to actually have a more in-depth understanding of the person, of just who they are, their actual goals with a conversation, and then bring in, that's the qualitative, and then bring in the quantitative, like let's actually run some deep labs and then talk about what can we do. And then here's the biggest thing, following up. Like, are we having progress? Because that does not happen anywhere that I'm aware of in, conventional care. Is like, whoa, hey, you're actually making progress. I mean, I guess if people are, really having an issue watching disease progress, we see that. But for someone who's starting at a point that they're healthy, how much more healthy can we get? You don't really see that type of driving. We like to see better labs, and so maybe if you could talk a little bit about your vision for what the practice is going to have for somebody, their kind of patient experience with those kind of pieces around the client.
Yeah, I mean, coming from the actual clinical side of this, there's a ton of good examples. If your A1C goes over 6.5%, we define that as diabetes, all right? That essentially gets you quarterly labs the rest of your life to some extent, right? Because we want to know if it gets worse. And then that logic should be applied elsewhere. Now, does everyone need to get quarterly labs? No, but the reality is that we can see patterns and understand what's going on and follow those things over time. And then on top of that, actually make sure we are driving the outcomes we want, right? So one of the biggest reasons that I needed to leave the medicine I was doing before was I oftentimes did not know how effective I was, right? And take that from any position, any job. If you didn't know how effective you were, it would be difficult to be able to change and sharpen your tools to doing what you need to do. So in our practice now, the members have to see me 4 times a year. The reality is I want to know what's going on. I want to know where we're at. Doesn't mean we're going to do labs every time, but we're going to do labs when it's necessary or when we see that there's an opportunity to improve. But I want to know what's going on, and I want to make sure that from day 1 to day 365, we are moving the needle on not necessarily just biomarkers, because like we said earlier, we could look at your biomarkers or my biomarkers and say, hey, they're pretty good. They're not getting better. Why aren't they getting better? Well, they're not going to continue to get better. That's not an indefinite thing, right? But are we getting closer to what our goals are, right? And, not to talk about our personal goals, but we have some overlapping ones that include increasing muscle mass, right? And that's something
or just not getting worse as we continue to age. Like that's another great thing to keep in mind, like, hey, this is a long-term commitment, which is very different again from that conventional model that you kind of walked away from. But hopefully it's like, hey, you're keeping up, you look like a 30-year-old and you're 50. That's awesome. So that's kind of another goal. Yeah, for sure.
Yeah. I think that there was a lot for me as a primary care provider. I knew exactly how I wanted to take care of patients, and I felt that I was being limited in some ways to being the best version of myself by not really understanding what was going on consistently with the patients and saying, well, I see somebody once a year, I see somebody every 18 months. And I used to see people for longer than the average primary care provider. I mean, my average was probably closer to 20 to 25 minutes, right? And so, but even then, like, the only people I really knew were the people that were really sick, because those were the people that were coming to see me consistently, right? And so, so that's where, like, I really kind of, my focus really, changed a little bit. Actually, it wasn't even just the sick people. I have a couple of patients that come and see me for medications renewal that need to come in every quarter. I knew these patients' health better than anybody else. And they got better health care because they were essentially forced to come in to get their medications refilled. Right? Yeah. Which is ironic, I think, to me. But the reality is I knew them really well. I was able to help them when something went wrong, right? And that's what I want to be as a primary provider. I want to be that person when someone needs something, they let me know and I guide them through it based on them not kind of a generic algorithm or whatever it is, or going to, immediate care. I mean, I had patients seeing immediate care providers even though I was their primary doctor because they couldn't see me. And that, to me, doesn't really make a lot of sense.
Yeah.
So,
Yeah, it's great. I mean, we've seen like so many other industries have just changes and iterations, and it's cool to see that there's new ways to do this, and this is exactly what we're doing today. With your
yeah,
practice of, hey, are you somebody who really wants to have a focused, like very individualized, thoughtful care plan built around you?
yeah,
If that's what you need or want, and you might not need it, just you're looking to optimize, it's kind of a much better fit for you. Now, if you're somebody who's like, hey, I'm in really good shape, I eat organic, I do this,
yeah,
probably fine. Like it's not like it's like, hey, come climb the door. But if you're like, I really want to have somebody who focuses on me as a person and individual and not just a number on a chart, that's really what you're going for here. Is that right?
yeah. I mean, I have had discovery calls for the practice with people, and I've told them that they need to think about whether this is the right fit or not, right?
Yeah.
And I think that I'm pushing people a little bit harder, and I understand this isn't for everybody, but I've seen so many people that are asking the questions about how do I go a little bit deeper here? How do I go
Mm-hmm.
here? Without being able to find the answers, or they have to go to social media for the answers. And we all know that there's a lot of concern about the recommendations being made, the qualifications of who's making them. And the one thing that people don't talk about, which I'm surprised more than anything else, is that it has to be in context to that individual.
Right.
I saw a patient earlier today who has calcifications in the coronary arteries, and you would say, "Oh, that sounds bad," right? But in context to the clinical scenario, it doesn't necessarily mean that the world's going to end here, right? And so, if you see something that says, "Well, you need to be on magnesium L-threonate because of this, that, and the other thing," and you say, "Well, I do need to be on that," like, you're making this decision based off of kind of generic advice. And that's kind of my point in all of this, is that if you don't want generic advice, you need to find someone to help you create
Yeah.
advice that's not generic, right? And that's
Yeah.
personalized,
Yeah.
right? So,
We have a saying, hope is not a strategy, and just
yeah,
kind of like hoping. I hope this works out. I hope this fish oil is doing something.
right.
I don't know why I keep bringing up fish oil. I think it's great. It's pretty low risk thing, no risk you could say. But it's just the supplement that comes to mind because it's in my normal fleet that I take. But it doesn't have to be like we brought up, like this idea of like you got to do all these things. It could be like change these 3 highly impactful things with somebody kind of pushing you in that direction.
Yeah.
And that can really change your life. Just recently you've kind of helped me on this muscle mass building journey, and all it really was incorporating heavy resistance training 3 days a week, and things have totally changed in a year in my,
Right.
body comp and,
Yeah.
and bone density and all these things. It just took like looking at a scan and like moving forward, and that didn't require me to do any crazy stuff. We still eat pizza. It's just like it's not every day, but like we haven't like lived under rocks for this stuff to happen. But the numbers look good, and
Right.
it's just I just think it's so helpful because people want to know these answers of like, what the heck should I be doing? I like hear all this stuff that I should be doing. It's like
Right.
Yeah. Get outside every day, sauna, wake up and do a cold shower. It's like,
Sure.
all right, maybe that stuff is like 0.003%, but the BMI, if we can lower that probably would do a lot more heavy lifting. And so, yeah, I guess, this kind of is a good parallel to like somebody comes in, they're like, I want to do something to be more healthy. What does that actually look like under, your wing here of like, hey, I'm meeting a person. Maybe you could walk us through like what the first appointment's going to look like, and then what would maybe like that year look like, and kind of a good summary, if that's a good place to kind of look at things for what can people expect if they want to, be a part of the practice.
For sure. I did one of earlier this week. I did one of my intakes, and the intakes are I usually spend like 90 plus minutes with patients. I have kind of an intake form. They come in. I mean, the idea for me, and I'll walk you through everything I want. I worked through the plan with her. We talked through everything that's going on, medical history, and all these things, and then I created the plan and sent it to her. And some people don't like all the detail, and she's like, more detail, the better, right? And the idea was, I really was in tune with everything that was going on with her life,
Mm-hmm.
and it didn't necessarily mean that she was perfectly healthy either. And so one of our normal initial visits, I mean, the intake form I leave a little bit more open-ended, and I think based on the individual, some people will fill out more information than others. But the reality is that when we sit down in the appointment, right, what I said at the beginning is the most important thing. And this is a goal-driven practice, and that if your goal is to be able to run a marathon, that's what will help you do. If your goal is to never run a foot in your life, that is fine too, right? And so
But we won't help you to do that. We're not going to say no running. Yeah.
I honestly, I think
Couldn't
I say
resist.
no running more than running, and I think that's ironic considering how much running we've both done in our lives. But
it's hard on the body, yeah, for sure.
it is.
Yeah.
You need to be prepared. The body needs to be prepared for it.
Yeah.
And unfortunately, our lifestyles of sitting too much don't prepare it well for it. And so on the risk of getting too far into running, we're gonna peel off a little bit. But the big thing for me was like, and I brought this up earlier, she wanted to be able to get up and down off the ground, right? And like that to me is an awesome goal, right? It's an awesome goal because it's attainable, and it just needs to work on what you mentioned before, right? And you mentioned this, and the most important piece is the consistency over time that creates change. The body has the ability to create change by changing your lifting workouts for a year's time. It appears to have seen rapid growth. The reality is it was slow growth over time. And with resistance training, there is kind of a faster growth and then slow and then steady over time. But like these are very obtainable goals that I think people think they can't obtain, and it's because they don't really have the roadmap to get there. And the roadmap doesn't exist because no one's taken the time to know them for 2 hours to understand this is the best way to go. And I'm not saying this in an arrogant way that I know the exact way to get everyone towards their goals, but the idea here is that if we can make small interval changes over time, I've had to do this with a number of different people that are unable to exercise for a number of different reasons. We have to get them back into some level of movement, but we need to create something that's very sustainable, and that comes with consistency, and it comes with me being there as an advocate for them, and then also being there when things aren't going well, right? When they don't want to do it, and these types of things. So this visit, like you were talking about, like I don't want to put too much emphasis on it because the product, so to speak, is not the visit. The product is the year, right, and the continuity of that over time. But in order to create the model that's going to be hopefully most successful, it's going to require a really good understanding of where they are, where they're coming from, and where they want to go. Yeah,
well said. And, we should talk a little bit about drugs. They're great. We have really advanced stuff, and, if conventional medicine, there's amazing things out there that can really lower your risk as well. And that's still a part of your practice too. It's not just the pieces of, hey, you should just be saunaing every day and that's going to solve your problems. It's, you still have a large bit of that ability to, prescribe and look at history and say, hey, I think this is actually going to be a great fit for you for this reason. I think that's a great thing to look at too, is it's not like you can no longer do this. All tools in the toolbox are available, which is pretty incredible. I think that's a really good thing to know as well.
I put it on my website for the same reason that you're asking. I was like, yes, I do prescribe drugs. I think that I went down the route of functional medicine early on in my career because I understood there was an opportunity to add more tools to my tool belt, right?
Yeah.
I'm an osteopathic physician. I use osteopathic manipulation. They're just more tools, more things to, work through different problems. And so medication, like anything else, is a very strong tool, and we need to understand the risks and benefits of those things, but how we use them in context to someone's health is important. And I'll give you an example because, blood sugar issues is a problem, and if someone is pre-diabetic or diabetic, I can decrease their risk of dying, that sounds like a little bit paternalistic, but medications have proven to do that, right? And so we can do that in
Yeah.
the context
Right.
and overlay of everything else, right? And we should, because we know we have the ability to do that. So we always need to be thinking about what works best for this person. And I'm hoping this won't happen as much in this practice as it did in my previous practice, but I've seen patients over the years where their A1C is, 5.5, which is normal, 5.6, which is normal, 5.7, which is prediabetes, 5.9, which is prediabetes, like 6 point, and just slowly go up, regardless of the fact that I'm saying, hey, this is something that's really, really important, and here's the lifestyle things we need to do to work on it.
Yeah.
And they try, and they're either not able to, or life gets in the way. Like, that happens all the
Yeah.
time. You have raising children, you have a full-time job, you have to do this, that, and the other thing.
Yeah.
And I get it. So we need to find that recipe for that individual person. And I think I don't like when some of these conversations get too far away. And I think there's a lot of fear-mongering going on here, too, and saying, like, if you're not exercising this much per day, you're more
Right.
likely to die. And, like, sure, there's data that might suggest that, but the reality of it is there's more tools that we can use, and we don't need to do a 30-minute exercise every day
Right.
in order to accomplish those goals.
Yeah, and especially where we're looking at like somebody's baseline too. Like I think if someone's feeling bad about how much they don't exercise or don't eat right or whatever it is, it's like you can always improve in baby steps and see where that takes you. And maybe there's, some type of conventional drug that's getting the levels that they need to be to get you ready to get back to working out in a place
Right.
that is going to change those other numbers. But yeah, I mean, there's baby steps you can do, and it can be a marriage of both, plans really. You guys can tell I'm not a physician right away on this call, but and then maybe I'll pause. The reason I'm here is I'm somebody that wanted to know these answers of like, I hear all this stuff, Tyler, like what should I do? And it's been really exciting to kind of be a small part of this practice of seeing I want to be better, but I don't really know where to start. And here's my goals, and then here's the numbers that I have. What can we do? And it's all things that I knew. Like, yeah, if I haven't lifted weights in 30 years, that's probably going to help with muscle mass. It was pretty easy to know that, but to have a measure in it, and then say, hey, maybe these things will be helpful for you in that journey. It's great to just have somebody you can ask the question to that's actually a physician in the space. And there's family history that I have of some issues, and it's great to look in the labs and say, hey, you don't really have to worry about your heart for these, levels, or your liver looks okay. But getting that checked all the time, so I don't have to worry about, family genetics coming up too, is just as important.
Yeah, I think there's definitely, an idea where we get concerned about, are we doing too many tests for people
Yeah.
that are healthy, right? Well, A, we don't know the definition of health, so that I would argue against that for one. But the other part of it is, I see where you're coming from. I mean, I think that's important to understand. But the amount of money we're spending on, like you said, a liver panel or lipid panel,
Yeah.
or something that's going to create some comfort in this is, I mean, I will tell you as a practice owner, and one that our membership, includes the labs, is really not significant, right?
Mm-hmm.
If we can know the information and it remains normal, or it's not trending in a certain way, it makes us feel more comfortable that our overall plan moving forward is doing just fine, and that we don't need to change or react. And that reaction piece is something that I think oftentimes the conventional model gets, blamed for as being more reactionary. Like, of course it does. That's the way it's designed, though, right? It's designed
Right.
in such a way to say, when your blood cholesterol gets above 160, your LDL cholesterol gets over that, we need to think about medication. And
Right.
so, well, what happened the year before when it was 140, and then it was 150, and then it was 155, and saying, like,
Right.
it's fine now, and now it's not okay. I mean, this is what we're talking about in terms of being beyond normal. Like, the normal person in the United States is not a healthy person, right? And when I say health, I'm talking about metabolic health in general, whether it's being overweight or insulin resistant or all these other things. And so, like, I'm not talking about, like, being beyond normal, like, where, like, so optimal that nothing's
Right.
ever going to die. Like I'm not in that camp of we're all trying to live to 150 years old. Realistically, I don't think
We're not trying to hack anything, would
correct.
be
Yeah,
my
right.
way
Yeah.
to put that. Yeah.
We haven't solved for something as simple as sarcopenia, and that essentially is muscle loss. Like we
Okay,
haven't
thanks for
solved for
explaining
that.
that to me.
Therefore, being
Yeah.
150 without solving for that would be miserable. As for many people have seen their family members at 100 years old, and
Hmm.
they aren't exactly busting out of their shirts and muscles, right? And so that's just one small example. Like we throw around the word optimal. Longevity field in general is very much so like how do you kind of cheat aging or anti-aging and things of that nature. And the reality of it is like I just want your body to run at its best capable ability at that moment for you in the context of your goals. Like it's a
Hmm.
lot, but it's very reasonable, and it does require some trial and error, right? And that's something that's okay
Right.
to be a part of it.
Yeah. Let's we can shift gears a little bit. Let's talk about how diet fits in all this because I think that's a place that's really missed. My doctors don't really ask me like, "What do you eat?" It's just like, "How do you feel? Any problems?" But I think it's good to think about that. Especially if somebody has some types of immunities that are causing issues or
Yeah.
whatever it is. So they've been talking about diet, and also just in that same framing, there's always a new diet that's the right diet. I say in quotes of, this is the time to be this, and we
Yeah.
found it really just is individualized in a lot of ways. But how will that fit into your practice when somebody comes in?
Yeah, I've gone through quite a journey with nutrition. I mean, this is how I got into functional medicine to begin with. I learned about the China study, for those who know that, and essentially it talks about how a vegan diet is the best diet, right? And we worked through what that means. Right now, it's pretty much generally recognized that a Mediterranean diet is the most well-studied diet for people, right? And so, from my perspective, I'd say that, yeah, that makes sense. It's well-studied. We could consider going that type of a route. But then I would also say, where is the individualization coming from this? And also, if somebody's not from the Mediterranean, are they going to eat a Mediterranean diet, and does that make any sense, right?
Right.
And so for me, I first like to know what they're doing at that moment, right? I mean, a big thing in the the diet wars, as they call it, is like similar to exercise. Eating the diet that you're going to maintain that keeps your BMI low is the correct diet, and it's not really wrong. But in the context of, for our practice, we're thinking about what is the body composition, how much visceral fat's there,
Sure.
what are we doing? Like the BMI is essentially not super helpful, but like, are we making decisions based on the information we have, or are we making decisions based on the scale? And we know inherently making decisions on the scale is not a good way to do it. And the number of
Yeah.
times I've had to tell women more than men that who want to lose weight that they shouldn't lose weight. Now, I'm not in the business of telling people how they should look. If that's part of your goal, that's an important part of your goal. But I want you to understand, or the individual understand from a health perspective, that losing weight is not necessarily a good thing for your health if you don't need to lose weight, right? And so
Right.
how do you decide who does and who doesn't? But I know what their body composition is, right? It's an easier
Yeah.
decision for me to make. If you're in the 10th percentile for muscle mass and you want to lose weight, that's not going to get better, right? And
Right.
so we need to think about how to approach that. And from the personalization standpoint, like I really like to take it back to the basics as it relates to diet and saying, what are the main features of our goals that matter here? Do you have
Hmm.
early heart disease? Do you have early diabetes, insulin resistance? Do you have a lot of visceral fat? Do you have genetics that kind of make you that skinny fat? And that's going to change how we approach this. And that doesn't mean the diet that I give to a patient is the correct one. It just means that is the one we're going to try based on the data we have, the information we have, in order to find something that is A, sustainable, and B, helps work towards those goals. And so it's often that this will happen, and I always use this example for cholesterol because I think, generally speaking, everybody wants to eat less fat to improve their cholesterol. I will tell you that generally across the board isn't necessarily a good recommendation because different people respond differently to different diets, right? I've seen people go on really high fat diets and improve their cholesterol panel. I've
Sure.
seen people with really high LDL cholesterol cut out all the saturated fat and their LDL looks beautiful. I've seen people do the exact same thing and the LDL is the exact same. And so this is when, these large nutritional studies become a problem for us, is that they're talking about large groups of people, right? And I have the privilege and opportunity to spend more time to understand what works for this person, test it, and rework it so that we can find this middle ground that balances being sustainable and enjoyable, not depriving yourself of food, but also maintaining and moving towards what our goals are, which ultimately for each individual is to find that person's individual healthy base level.
And I think something that you kind of said quickly, but you mentioned, we're going to look at their body count, we're going to look at their visceral fat. That's just not what you're getting in a typical practice anyways. Is you guys are going to actually do the scans. You're going to look at it. You're going to see what it is and be like, well, this visceral fat is actually an issue. We really need to think through this. This is something that and maybe talk about like the parties that you're going to have involved for your typical patient, because this is beyond the level of care you get at your typical, primary care doc with some of those tests that you'd be doing.
And I think that part of the reason these testing aren't involved is because you need to have an opportunity to be able to make change when you see those results, right? If you don't have an opportunity to make a plan based on increased visceral fat, why test it to begin with? Now, I mean, I've run into that problem before too, whereas I think I've had patients talk to other people and say, well, which diet should I do for X disease? And the clinician says it doesn't matter. And the reality of it is if you look at the data in the context that we have it, we don't know that it matters or not, right? And so that's a really striking thing, that they're not wrong. But from my perspective, I find that they are, because we have an opportunity to still personalize it to see if we can improve that specific thing, knowing that like diet, for example, can reverse heart disease. Like knowing that is a very interesting thing. Doing the diet in practice, maybe not so much. Sorry, I didn't answer your question at all. I went straight back into food. We'll come back.
No.
So the question you were asking is like from a body composition standpoint, or part of what we do is, we're doing a lab panel. It's more extensive than the standard lab panel. A lot of it's to understand baselines, understand where things are moving, a little bit more advanced on the lipid front. We want to stay ahead of things as much as possible. I want to think about things from a preventative lens as much as possible. We want to think about prevention from a cardiac standpoint, where we're talking about a little bit more in-depth labs. Nothing crazy. I'm not going to get into the list. If you guys are interested, actually, we could the website. I have them all listed out. The metabolic health piece. We're always just interested in getting kind of ahead of these things. We're doing body composition with DEXA scan, probably the most reasonable from an accuracy standpoint, versus doing like a full body MRI, which isn't quite cost effective yet. Trying to identify those things. We're testing people's cardiorespiratory fitness with VO2 max. This gets all sorts of. It's been very popular on social media recently. Is like, does everyone really need to do this? It's a pretty intense thing to do. And I would say, no, everyone does not need to do this. But my question to you is, if one of your goals when you're 70 is you need to be able to walk up a hill at 3 miles an hour. Now, I'm not making that up. I'm taking that directly from VO2 max projections over time. You need to have a VO2 max above a certain level in order to do that. And we can project this all out over time. We can see if your VO2 max is 32 now as a 40-year-old, and then it goes and it becomes 22, and it keeps going down by the time you're 70, because I think it goes down, I don't remember the numbers off the top of my head exactly, but it goes down roughly 8 or 10% every decade. You're starting to get into this point where you're saying, I'm not able to do some of these basic things, and this is one of the saddest things that I've seen clinically. Someone retires at the age of 65 or 70, and
I was about to bring this up.
Do what they want to do.
Yeah, you want to go to Italy and climb those stairs, and you work this super long career, and now you're like, this sucks. I'm out of breath.
You want to watch your grandkids, but you can't chase them around because they're too fast. Like, you know what I mean? Like, you can't pick them up or hold them for more than a couple of minutes. Like, these are all trainable things that you can do and make sure you continue doing with very small changes in your day-to-day life. But it just needs a little bit of direction, right? And
Right.
people need a little bit of help and understand where they're at, and then we can make changes and see where we're going. It's like I think conceptually, I'm not pretending like I'm coming up with this new novel great idea. Like I don't think this is conceptually difficult. Understanding where you're at and making choices based on where you want to be using projections that we already have is something I think is really reasonable, but it needs to be done in a way that's early enough where
Yeah.
the longer you wait, the harder it gets.
It's a lot like saving for your retirement. Like you put money away and you're like, I'm not going to use this.
Yeah.
And why? Because you're like, oh, I want to use it later because like I'm going to need it. It's like invest in yourself today because you want to be able to enjoy a better life when you're later.
Right.
It's like everybody is okay with putting money in their 401k. You should be okay with helping yourself out in your 70s now.
Yeah.
And I think maybe
And
that's
I've
an.
had
Oh,
yeah,
go ahead,
go ahead.
T. Yeah.
I've had a little bit of kind of pushback here and there from potential clients about what it looks like cost wise to think about these things. Is it necessary to spend the money now in order for then? I mean, I'm obviously super biased. I mean, I think it is, but at the same time, like I've
Yeah.
invested a lot of money in my house and whatnot in order to try to maintain health, right? And the care that I seek out and whatnot, and so like I'm biased towards that, obviously, but at the same time, like I think that thinking about it as an investment is worthwhile, knowing that I mean you've like I know you've had people in your family go to the hospital before, and you understand the sheer cost of going to the hospital.
Oh,
Like
unreal.
I'm
Yeah.
not telling you I can prevent you from going to the hospital. Like that's not really what I'm telling people, but I'm also saying that we have the information, we have the ability to collect information to the point where we can decrease that likelihood, which will save you money, right? It will save you money in the long run, right? And I truly believe that's the case, and that I wish this model of care would be a little bit more attainable for more people from a cost perspective. But the amount of time required to understand an individual, I think, is pretty high,
Yeah.
and so I think investing early does make sense to be able to really decrease the likelihood. I mean, that's what we're all talking about, likelihood here. I mean, I wish I could tell you that if you invested X amount of dollars per year, you're going to have X amount of money, like a financial planner. But I can't. You know what I mean?
Yeah.
Like
Yeah.
I
Right.
can't tell you that projection.
I
But
think people would give you a pass on that. Yeah.
but at the same time, like when
Yeah.
we're
Yeah.
thinking about. I've always thought about them. The first time I met a financial planner, and he said, "Well, when are you going to die? Right? How old are you going to be? Right?
Right.
Like
Right.
when are you
Yeah.
going to? It's like you're going to make it to 90. This is how much money you need to do that." And I think the exact same thing. Right? I'm like,
Yeah.
how much money do I need? Or no, I'm not sorry. How much money? How much health do I need to make it to a point where my son or his grandkids are X age? How much health do I need to get there? Right? That's
Yeah.
what I'm thinking about.
That's a great lead into kind of one of the things I want to talk about. So, like, you're just an example guy or gal. You're 40 years old and you're still pretty capable. Obviously, you can tell that it's harder to do things than it was when you were in your 20s, and I think everybody can relate to that. There's a little more aches and pains getting out of bed, but overall, you still can move around pretty good. You might have a couple kids. Like both Tyler and I are dads of young children, so I'm constantly strapped with like a stroller, diaper bag, holding one kid. You're able to still do the job of
Hmm.
heavy work. But that window of time, is really important for thinking about the trajectory of what your 50s, 60s, 70s could look like. What type of stuff should somebody be considering doing at that age now to really pay those dividends? Like, what can we really be thinking about, and how will your practice help them get there?
Yeah, there's so many people at so many different baselines, and like
Right.
that's why there's a lot of times where I hear some people on social media, and like it just sounds so appealing, right? Because it's so like you have to do this, and then you have to do this, and then
Oh,
and then when I
God, I
talk
hate
about it,
it.
I'm like, it
Yeah.
depends on the person, like you know what I
Yeah.
mean. But at
Yeah.
the same time, like,
Well,
go ahead.
also too, like on social media, it drives me crazy. One, if you're on it, and I'm guilty of it, I'm on it, but like you see, like this is my perfect life and everything, because we only
Yeah,
see the good. No
yeah,
one's posting about bad stuff. But also, how about it? Like I wake up at 5 in the morning and I, do my smoothie, and then I sit in my sauna, and then by 6 I journal, and it's like, ooh, I wake up after a night of like changing wet diaper because a kid peed through the bed, and then I'm tired to wake up for my workout, so I'm rushing to make my coffee, and hopefully I can squeeze in a workout at lunch over work, but
Yeah.
then work was too busy. It's like it's just like if you're a working parent, like all
Yeah.
this like what must be nice, like
Yeah,
for
yeah,
all of
yeah.
that. And
I
so
was in the bed with my
yeah,
child this morning, so I'm being kicked.
yeah,
But it was, the reality was like, I think you're right, and like it goes back to the conversation at the beginning. What can the
yeah,
practice offer? What can I offer? I mean, it's an opportunity to find those weaknesses, to find those things that are going to provide the most benefit, right? It's an opportunity to look for those things and find those things, knowing that if you look at people's trajectory and health over time, we do see a decrease in the 40s and 50s, especially muscle mass after the 50s, and the question
yeah,
becomes, a lot of us are in that time where we're doing a lot of taking care of others, whether it's parents or children, and it's hard to spend time for yourself. And I see these people all the
yeah,
time, right?
yeah,
And you know, like we talk about it for ourselves, like full-time jobs, parents, all these other things. It's hard, and for some people, are single parents. I mean, I can't imagine, and I feel a lot of regards to be lucky in some instances. But the
sure,
reality is that there's still so much that can be done even within day to day. One of the things I brought up to, so I was faculty with a residency program, was to with our residents, and there I do wellness with the residents, and their question is like, how as a resident, when I'm working 60 to 80 hours a week, I have kids, I have this and that, how am I going to be healthy, right? How do I do
yeah,
this, right? And I'm
yeah,
saying that, like, do you have to work out? Do you have to do this? Do you have to do that, right? And I very strategically never tell anybody what I do, because I don't think that's the point. The point of what I
right,
do is irrelevant to what you need to do. And that, like, one of the things I had resident do is I said, hey, maybe you should, when you're at the hospital, you're always going up the stairs. Or one of the rules I had for myself when I was at the hospital working overnight is I didn't eat outside of normal eating hours, or you have to bring your own food, or you create
right,
these kind of
yeah,
small things that aren't huge groundbreaking changes. I'm not saying, hey, you're working 80 hours a week, now you also have to go to the gym for 6 hours a week. Like, I understand, as having gone through residency and doing that, like, that's not necessarily a reasonable thing to do, and I exercise a lot more than the average person. So how do you stay healthy in those things? I mean, for me, I think those people need more of the guidance than someone who's has more time on their hands
sure,
and spends more time exercising, because you need to be more strategic about the time you do have. And if you have 2 hours to exercise, that's very different than if you have seven. What you do and how you do it's different. But if you go to any influencer and see, they're going to tell you what type of exercise you need to be doing. And so the
sure,
reality of it is, once again, it's personalization is a recipe of success, right? And that, like, those people probably need more assistance than anybody else, but it's not that they need me. They just need the accountability to make sure they're staying on track, which is why we do the quarterly visits and saying, are we still on track? Are we still on track? Are we still on track? Right?
yeah, yeah.
So hopefully
Well,
that
that's
answers the
great.
question. But
Yeah, I think it does. I think it's really just if you are in this phase today, you actually have the ability to do something about it. And if you're in your 40s, early 30s, but even 50, there's a lot you can always do something.
yeah, for sure.
But maybe as we get close to an hour, and listeners, let us know if you would like specific topics discussed, or if you like to make it shorter. We can do that. But I think a good way to maybe kind of land the plane would be, what does the end result look like? Like, you're meeting somebody, what do you want them to have their 70s look like for that individual? So you meet somebody and they're 45 today. What is a goal for you to have? What does that patient look like in 75? Like, what do you hope the practice can offer to somebody like that? And what value is that going to add to their life?
Yeah, and I think every you've seen the people that everyone kind of aspires to, and they're kind of like,
Mm-hmm.
well, how come that person got to be so fit? And it's like,
Right.
and maybe it is the exercise, maybe it's something else. Genetics play a huge role in some of this stuff,
Yeah.
but a lot of it's relatively controllable, and we start to see it. I mean, we've seen it already in people that we went to college with that have changed over time because they don't do the same level of exercise or they're not maintaining certain things. Like, what is success? It's really on an individual basis, but I want to see people continue to maintain their independence and do the things they love doing, right? Like, the one word I haven't said that's probably more important than health span is quality of life. Like, I want to focus on how can we maintain that person's quality of life every single time we check, right? And so when we get to the age of 75, we're saying, I am enjoying my quality of life. And if we're enjoying our quality of life now, I think it's reasonable to continue to maintain that process. Where we go astray from that is when 2-3 years go down the line and then we're like, oh, how did we end up here? It's very easy to end up here. I mean, you think about our food system and how it's making it difficult. You think about how our jobs make it very difficult for us to stay consistent with exercise and sleep.
Yeah.
Our sleep environment has gotten so much worse. And so, like, if we can be able to stay consistent with that and we can enjoy our life at that point, which isn't just maintaining all of the lifestyle things. I mean, two things we haven't talked about that are really big, that are things that I really like to focus on, is stress and relationships. And that, like, if we don't have these things at that point, we're either A, not going to make it there, or B, we're not going to be enjoying it when we're there, right?
Right. Yeah. Yeah.
So,
no, that's well said.
Yeah. So, I mean, I think there's, like I said, it's not sexy, but it's personalized, and it's understanding what's important to that person, right? And I think, like, I was just talking to my parents. They just got back from a trip in Europe, and, like, they're enjoying themselves, right? And, like, that's exactly what you need to be doing, right? In retirement, hopefully. But a lot of people don't get an opportunity to do that, and I think that's too bad. And I think part of that is bad luck, but part of it, I think, is potentially preventable things if we kind of invest the time to think about them in that way and kind of help create a built-that model, so we're not going down a path that's going to get us to a point where, we don't want to be. I mean, I like I said, health is one of those things. People have diseases that are random for all sorts, and these things, and, like, we can't 100% prevent those things, but we know that a lot of the things we can do can decrease the risk of things, and we need to kind of figure out where individuals' risk tolerance is to spending a lot of time or more time focusing on lowering that risk over time.
Yeah. And that's great. And it's really just like we talk about, like, investing in yourself so you can have this high quality of life when you want to be enjoying it, when it's not easy to have a high quality of life, And so I think that's the goal, really.
That's one of the honest reasons for why I've decided to make a move into a different style of practice is I spending 12 hours a day taking care of 18 plus patients a day, right? And then coming home and my child's asleep. Like, that's a quality of life problem, right? And so I look to change that. I look to spend an opportunity with that by taking care of less people, taking care of people better, which is better for my mental health, better in my opinion, and then being in a situation where I feel comfortable, and so, like, that's what I'm striving for. I truly do try to practice what I preach and try to continue to find the best solution for myself, as long as I'm also helping and looking for patients.
Yeah. Well, you started the business, so you get to decide how it runs. So hopefully it's in line with your passions.
So I'm gonna leave you up to be my accountability partner on that side of things. All right.
Yeah.
So I'll do the health stuff, and you just make sure I keep all that stuff together.
Yeah.
But,
you got it. Anytime.
Great. Okay. Cool. Anything else you wanted to add in before we kind of wrap it up?
I think we got it done. We're just shy of an hour. This was great. I guess the final thing I'll say is, I'm on the same journey. It's just, someone who wants to learn how to be at my best. And it's been awesome to just look at different ways, because you hear an opinion on everything. What you should be doing, what you should be eating, fat is bad, fat is good. Eggs are good, eggs are bad. It's just like to have something to look at and just figure out what are the real actual things I should focus on.
Yeah.
There's so much noise and just misinformation. So I hope this podcast helps with some of that, and we can get more granular in the future.
Yeah.
But this was a great introduction, and thanks anyone if you made it this far.
I think, I think that our ideas about how we should take care of ourselves are going to change. We're going to be changing over time. We're going to continue to change. So, all right, great. I think we did a good job. All right, I'm going to bring in our outro. So thanks, TJ, for spending the time having this conversation with me. Hopefully we can have it some more in the future. If any of this that we talked about resonated with you, you felt like you want to take your health to deserve more attention, you want to think about, is the system giving me everything that I need towards my goals? I'd encourage you to visit us, healthspanchicago.com. We're accepting patients. Love to have a conversation. We do free discovery calls if you want to get a little bit more about what we're about. One important note before we close, the content on this podcast is for educational, informational purposes only. It does not constitute medical advice, and listening to this episode does not create a patient-physician relationship between you and me or HealthSpan Chicago. Everyone's health is different. Please work with your own physician before making any medical decisions. We'll see you next time on Beyond Normal.